Hi, everyone. This is CuraCore Academy Talks, and I am Dr. Narda Robinson. I'm an osteopathic physician and a veterinarian, and founder and CEO of CuraCore Med and CuraCore Vet. Before we get started, this is a disclaimer. So, I'm not giving veterinary advice. I'm not telling you how to treat your dog or cat. My target audience includes veterinarians, vet techs, and nurses, just education for even veterinary students who might not have learned these topics or maybe as fully as I think they should in school. So that's the purpose behind the CuraCore Academy talks. Today, we're going to explore the question about whether flea and tick products pose dangers to animals or humans. So there are two prevailing views. One is by those who consider the products out there to be safe and really important to control flea and tick-borne diseases. And there's no doubt, as we will cover, that fleas and ticks do produce morbidity in animals and even people. The other view is that flea treatments are killing cats and dogs or harming them in certain ways, in many ways, and so that we have to be more careful and have more scrutiny over the safety and the claims that these drug companies are making. So what we'll cover today are news and views and pros and cons concerning the parasiticides, as well as questions that I think that you should be asking. So what's the public reading online? Here's one from the pets section of WebMD. A top-selling flea collar that may be linked to the deaths of nearly 1,700 pets and hundreds of injuries to people should be recalled, a U.S. lawmaker says. And that's just from March 19th, 2021. Today, as I'm recording this, it's March 28th, 2021. So this is all very new. And they continue, since the Seresto collars were introduced in 2012, there have been more than 75,000 incidents ranging from skin irritation to seizures and to death, reported to the U.S. EPA, the Environmental Protection Agency, according to government documents obtained by a nonprofit group. And then Elanco says it will not issue a recall. USA Today, just a couple days ago, said class action lawsuit is being filed against the producer of Seresto flea and tick collars. They say two pet owners who claim their dogs either died or developed problems after using Seresto flea and tick collars filed a class action lawsuit this week against Elanco Animal Health, alleging it misrepresented the safety of its product. They quote, say the lawsuit is likely the first of dozens, according to Spencer Sheehan, a New York-based customer liability attorney with a history of filing class action lawsuits. He's part of the legal team representing the plaintiffs in this case and said he expects other law firms to file similar cases across the country. So what happens if we do actually find that products that veterinarians have been selling to clients and promoting as safe and effective do have problems that we weren't told about? Do we say, oh, we're sorry? Do we say, well, I'm accountable and I am intent on reducing risk, so we're going to have to change up some things? From the Veterinary Information Network, known as VIN, from March 5th of 2021. Quote, veterinarians temper flea collar fears raised by news report. Alarm about Seresto collar is based on anecdote and likely unfounded, they say. And quote, looking at these reports, these are very random things ranging from ruptured eardrums, which I can't make fit really well at all, to liver failure, to heart problems, to kidney failure, said Tina Wismer, medical director at the ASPCA Animal Poison Control Center and a toxicology consultant for VIN. The fact that the signs are very random makes me think that probably the collar is not involved, she said. And then another VIN toxicology consultant said, noting that consumer reports to the EPA are unverified enough and anecdotal, anyone can report anything to regulatory agencies. That doesn't mean it's true or accurate, she said. This is why looking at the raw data from these agencies is so dangerous. They reflect only the reports, not any ancillary information required to determine if there's actually any merit to the report. So, okay, it's good to be careful. They continue, quote, when consumers report adverse effects of products to federal agencies such as the EPA and the US FDA, the Food and Drug Administration, she said, specialists, including toxicologists, review the data to determine whether there is potential for concern. And if there is, they generally take action. She says, I trust that they have vetted the reports and determined that there is no cause for concern. So this is what she said about the Seresto-associated cases. And then furthermore, the existence of counterfeit collars could complicate interpreting incident reports. Fake collars, which reportedly are widely available, may contain ingredients that are harmful to pets. Well, you know what? For me, if that's the case, who's supposed to look out for that? Who's supposed to be testing what is sold online and what consumers are buying? Isn't there some kind of way for people to know, A, whether it's real or counterfeit, and B, what's in this stuff? So they continue, you don't necessarily know where these colors are coming from and what is actually in them, Wismer said, and that could explain a lot of the different kinds of clinical signs that we are seeing. Elanco finally put out a statement 10 days ago. They said, based on recent misleading media coverage, a U.S. House of Representatives subcommittee member made a request to Elanco Animal Health Incorporated to temporarily remove Seresto collars from the market. Elanco reiterates that it stands behind the safety data of Seresto generated for its registration and monitored via post-marketing surveillance. And Elanco continues, all data and scientific evaluation used during the product registration process and through Elanco's robust pharmacovigilance review supports the product's safety profile and efficacy. Therefore, no market action, such as a recall, is warranted, nor has it been suggested from any regulatory agency, end quote. And quote again, Elanco continues to stand behind the safety profile for Seresto. The product remains available to consumers across the U.S. and around the world for protection of pets from fleas and ticks, which can negatively impact their quality of life and may act as vectors of dangerous disease. So some of you may be wondering, why am I only now hearing about issues with the flea and tick products that I learned to prescribe and have been told, we're safe? Well, a lot of the information about pesticides is not new. And the Veterinary Information Network had put out back in January a piece called Researchers Suspect Spot-On Flea Products Pollute Water. And, quote, some scientists are urging veterinarians to weigh the potential environmental risks of spot-on flea treatments against their animal health benefits, citing mounting evidence that the product's active ingredients are contaminating waterways. Continuing, quote, concerns about the ecological impact of certain flea controls have been stoked by new British research, which backs findings from recent studies in the U.S., but is contested by a study funded by spot-on manufacturer Elanco Animal Health. Quote from Vinton, the chemicals are active ingredients in many topical flea treatments, including in popular brands such as Advantage and Frontline Plus. The products long have been valued by the veterinary community for their effectiveness, ease of use, and low toxicity in mammals, including humans. In addition to killing disease-causing fleas and ticks, however, their active ingredients can also kill tiny aquatic insects that are a crucial food source for fish and birds. Continuing, quote, the toxicity extends to beneficial terrestrial insects as well. And continuing on, the toxicity extends to beneficial terrestrial insects as well. And this includes bees and, from other papers that I've read, even butterflies, but not limited to those two. Quote, some researchers hypothesize that the treatments contaminate waterways after being washed down drains when pets are bathed, when owners clean their hands, or when pets swim in rivers. And then, quote, the magnitude of the problem is very big, Dr. Martin Whitehead, a veterinarian at the Chipping Norton Veterinary Hospital in England and contributor to the British study, told the VIN News Service, quote, "We regard this paper as an alarm call to the profession," end quote. So some veterinarians that I've talked to are like, well, I had no idea about that toxicity, but what am I supposed to do instead? Give me some ideas of other things that I can use. And my response is typically, let's look at the science. So, yeah, vector borne diseases are a One Health issue. Um, Ticks, mosquitoes, fleas, and other vectors feed on people and animals, including pets, livestock, and wildlife. This is a graphic from the CDC. Vector-borne diseases can have a serious impact on the health of people and animals, and people who work in human health, animal health, environmental health, and other relevant sectors need to work together to prevent and control vector-borne diseases. What I would add is you need to work together to make sure you're not harming one, two, or three of those each, things that comprise One Health, the veterinary aspect, the human aspect, and the environmental or earth aspect. So why control fleas? Why else? Well, we're going to reduce the morbidity of these diseases, reduce transmission, and prevent deterioration of the human-animal bond if you're afraid of getting something from your animal. Well, what happens? Are you afraid of maybe getting some of that insecticide from them? Have we thought of that? Have we talked to clients about that? So there are a bunch of prevention measures. You can clean the bedding, do more assiduous cleaning of the rugs, and maybe even steam cleaning. So if you look at the Environmental Protection Agency websites, and the NRDC, the National Resources Defense Council, there are lots of suggestions on how to decontaminate your house and the area around your house. But chemically controlling fleas is sort of easier, and it's what we are inundated with as veterinarians through our reading material. 3 journals that I got this month have ads on the front and the back about different types of insecticides to apply to animals and sell in your practice. So, but if we're going to try to control fleas, less synthetic pesticides, that can include also the things we've mentioned about the home, also using flea combs, but also being careful about natural repellents. So not introducing toxic agents, even if it's natural, and whether it's a repellent or an insecticide itself. So when we're trying to actually kill an individual that's not your animal or not your client's animal, it's like there's a fine line there, because think of it, there is a lot of complex neurologic anatomy in even small little bugs. I mean, if they have a face, they're controlling it with nerves. They have limbs, they can fly, they can jump, whatever they're going to do. You're trying to inactivate them, but not inactivate your animal or the people in your home that might come into contact with that. So how do these synthetic insecticides work? Well, we have organophosphates that are acetylcholinesterase inhibitors. So you're not going to inactivate that acetylcholine. And so we'll talk a little bit more about that. There's fipronil, which is a GABA receptor antagonist. There's imidacloprid, which is a neonicotinoid. I don't know how to say it any better than that. But anyway, it paralyzes the flea by blocking acetylcholine receptors. So different ways to approach the nervous system and kill, or in the instance of insect growth regulators, we are mimic insect hormones, maybe combining that with some of the toxins. But if you get a huge amount of organophosphate poisoning for you as a human, in a human, the symptoms and signs that have been reported are confusion, agitation, seizures, excessive sweat, salivation, excessive mucus and tear production, possibly arrhythmias, syncope, respiratory depression or arrest, coma, and death. Fipronil poisoning, large amounts, we're talking about ataxia, abnormal gait, hyperactivity, tremors, cramps in muscles, and seizures. So you might say, well, we're not getting large amounts. We're not intentionally poisoning ourselves. Like some people in other countries, I don't know about the US, but it's been reported in other countries, attempts at killing oneself. But the thing is, how persistent are these in the environment? How much close contact over time are you having with your animal? what about your children? What about the 8-week puppies that now can receive some of these products for their whole life? What is the bioaccumulation of this? What about certain genetic predispositions to certain diseases? What are the drug, insecticide, even herb interactions? So, who is most susceptible? How is the client applying them? I know on the AVMA site they have a video and insist that the client read the full directions on the box. Well, that's a lot of reading, and I think a lot of people don't read that closely or um, intensely or really understand what they're looking at. I mean, when was the last time that you told the client to read the full label, and when was the last time you read the label? But anyways, the neonicotinoids are in the big amounts, potentially causing rhabdomyolysis, acute renal failure, respiratory failure, ventricular fibrillation, and myocardial ischemia from coronary vasospasm. And then you have, of course, over-the-counter flea collars. And so these over-the-counter flea collars were thought to be unreliable until Seresto from Bayer arrived. So we have 10% imidacloprid, which is a neonicotinoid, and 4.5% flumethrin, which is a pyrethroid. And these are rapid killers, kill within a day, and then new infestations from the environment are eliminated within 2 hours. So how does that happen? Is this stuff just pouring out of the collar and just like woo, woo, you are eliminating infestations from the environment within 2 hours from something around this animal's neck that's going throughout the room, through the house, killing fleas, and what's happening? Is it airborne, right? If it's you're not touching every single infestation in the home. So how actually is going on? And if it's like liberating this chemical, well, your brain and your olfactory neurons that are extension of your brain, your lungs, that's in the vicinity. And what about the members of your household, your kids, who's hugging that animal day to day to day to day, who's sleeping with them? Not that I think that you shouldn't be close to your animal, but when they have a flea collar on, is there a possibility that that could cause problems in the own animal's brain? And then who's around? What about the baby in the household? What about people that are compromised in some way? So, pyrethroid poisoning from one of these ingredients can, in a big way, cause seizures, coma, pulmonary edema, and hemorrhage. The mechanism of action is unlike the others. So it's working on these voltage-gated channels, like sodium and chloride channels, that are present on nerves and muscle cells and the brain and glands. So just causing repetitive firing, just chaos in these channels that are fairly ubiquitous. Those things that are not a collar can be topical, applied directly to the skin, or even tablets now for dogs, and are effective against fleas within about 8 hours. And the advantage of the oral product is, well, they're not going to go in the stream and swim that off. We're not going to groom it off. And then there'll be less of a transfer to humans, it's thought. And some people assume that it must be safer if you're going to consume it. Well, um, where's that data? Where's the data that compares all these different products that are advertised on the front, the back, and the inside of these journals that come out and that are, so heavily represented at your continuing education meetings and possibly in the pharmacy of the vet school? So how do we know how to make the best decision for our patients? But then we're safe, right, as humans, because if you read some things, it's like, well, this is going to act on the insect's nervous system, not mammals. Okay, well, back a ways, an organophosphate that was used quite a bit was chlorpyrifos, and then fipronil came out, and in this study published in Brain Research Bulletin in 2009. Is fipronil safer than chlorpyrifos? Comparative developmental neurotoxicity modeled in PC12 cells. And as they say in the abstract, fipronil, a GABA A receptor antagonist, is replacing many insecticide uses formerly fulfilled by organophosphates like chlorpyrifos. Few studies have addressed the potential for fipronil to produce developmental neurotoxicity, because that was the problem. Chlorpyrifos was especially worrisome in children that would be exposed to this nerve toxin because they were developing still. And so fipronil came out. Well, did you ever ask for that evidence? Like, okay, so this is better and it'll be safer and I can have more confidence prescribing it. Well, in this study against cells now, our results suggest that fipronil is inherently a more potent disruptor of neuronal cell development than is chlorpyrifos. Continuing to quote from the abstract, if fipronil is intended to provide greater safety than chlorpyrifos, then this will have to entail advantages from factors that are as yet unexamined, including exposure, persistence, and pharmacokinetics. So that exposure is important. It's not a one-off interaction with our animal. We are living with them. And here, from the review of environmental contaminant toxicology in 2003, a paper by the name of Fipronil, Environmental Fate, Ecotoxicology, and Human Health Concerns, stated in the abstract, one of its main degradation products, fipronil disulfonil, is generally more toxic than the parent compound and is very persistent. There is evidence that fipronil and some of its degradates may bioaccumulate. Now, thinking about chlorpyrifos, what was the history on that? Well, September 1997, breathing or ingesting chlorpyrifos may result in a variety of nervous system effects, ranging from headaches, blurred vision, and salivation, to seizures, coma, and death, depending on the amount and length of exposure. So, in general, where could our clients have found chlorpyrifos? In over-the-counter flea collars. But then it seemed that this agent was being banned, and then it wasn't. What was happening there? And now even we see that cat fleas are becoming resistant to this substance. Well, the EPA put out a document talking about where chlorpyrifos could show up. And had corn lately? What about edamame? Have you been thinking about your next cranberry sauce for the holidays? And what about that good old good-for-you broccoli? Well, the largest agricultural market for chlorpyrifos in terms of total pounds of active ingredients is corn. It's also used on soybeans, fruit and nut trees, Brussels sprouts, cranberries, broccoli, and cauliflower, as well as other row crops. It can cause cholinesterase inhibition in humans at high enough dosages. That is, it can overstimulate the nervous system, causing nausea, dizziness, confusion, and at very high exposures, like accidents or major spills, respiratory paralysis and death. So you'd think maybe this is something that we shouldn't consume. In 2017, the Union of Concerned Scientists put out a case study called How Dow Chemical Influenced the EPA to Ignore the Scientific Evidence on Chlorpyrifos. And it started to be used again. And why this matters, quote, the EPA banned the use of chlorpyrifos indoors in 2000, citing concerns for the health of children. And continuing, quote, the power that companies like Dow Chemical wield in government can give them special access to administration officials, which in turn can allow them to unduly influence federal policies in ways that serve corporate interests rather than the public interest, end quote. So perhaps we should study this whole area more closely, not only chlorpyrifos, but all the different and current agents that are being used widely, even around the world, and often. So here we have a study. It was a survey completed on the canine use and safety of isoxazoline parasiticides, reported in Veterinary Medical Science in 2020. A little bit of history on these compounds, many of which will be familiar to you. They were first designed by DuPont Pharmaceuticals as antithrombotic agents because they inhibited the activity of coagulation factor 10A, and side effects included excessive bleeding and hemolysis. But since they also killed insects, they were reintroduced as parasiticides. Quoting from the paper, subsequent to their development as parasiticides, they are now widely used throughout the world and are considered by most to be efficacious and safe, even in 8-week-old puppies. Continuing quoting, however, despite the estimated millions of doses being given, adverse events, AE, that had previously been believed to be rare, post-marketing AE have been increasingly reported since the release of these products. So what happens when you have adverse event reporting? Well, the company can either acknowledge and make changes to the label, or acknowledge but not make changes to the label, or just disregard until the FDA forces them to make changes. So back to the beginning when we were thinking, well, are clients like misreading this? Are they making things up? Are they over dramatizing the results? So to find out more, the authors of this study surveyed veterinarians and animal caregivers using a specific type of survey called Project Jake. This gauged the use and safety of isoxazoline parasiticides administered to dogs. They received over 2,700 responses, and this was just in the month of August 2018. And most of the respondents who used a parasiticide for flea control used an isoxazoline product, so over 1,300 of them. And so what you may find familiar from the names, the chemical name fluorolaner is Bravecto, afoxolaner is NexGard, and Sarolaner is Simparica. Comparing their survey results to what was in the fluorolaner package insert, they found 4 times as many animals had decreased or no appetite. So it was 28% in the survey, 7% in the insert. Excessive drinking was found in 17% by the survey, 2% in the package insert. So keep in mind that if that package insert was developed over the course of the investigational new drug development kind of thing, then that had, obviously, as you see here, many fewer individuals. So lethargy and depression, in the survey, there were 248 that were reported to have lethargy and depression. That was 31%, almost a third. Versus the package insert, they only looked at 12, and that was only 5%. So 6 times as much by the survey. 180 in the survey had diarrhea, so 23%. In the insert, it was only 11 studied, and that was 5%. Vomiting, 21% in the survey, 7% in the insert. Death, 15%, which was 117 individuals in the survey, and in the insert wasn't reported. Other signs not reported on the package insert: seizures, convulsions, shaking, trembling, ataxia, instability, weakness, restlessness, anxiety, panting, itching, scratching, abnormal feces, all in the teens. So between 15% and 19% for each of those. Humans aren't necessarily off the hook because there's a fluorolaner product that's recently been approved for the treatment of poultry in Europe. So when we talk about One Health and how we are protecting human, animal, and environmental health from infectious disease or vector-borne disease, why aren't we also thinking about the one sickness that can come from our iatrogenic urge to control problems in one of the 3 animal, human, or environmental health, domains, and see how it can influence all of them. So the things that we do might be harming. It's not just the world at large. The CDC has a document on exposure risks for veterinary workers to these kinds of pesticides. And it's called Illnesses Associated with Occupational Use of Flea Control Products, California, Texas, and Washington, 1989 to 1997. Quoting from their report, dips, shampoos, and other insecticide-containing flea control products can produce systemic illnesses or localized symptoms in the persons applying them. Who's that? Although these products may pose a risk to consumers, they are particularly hazardous to pet groomers and handlers who use them regularly. What about veterinarians who are seeing animal after animal with who knows what? How many Seresto flea collars have you encountered in the past week in your small animal practice? And then Occupational and Environmental Medicine from 2014, the association between ambient exposure to organophosphates and Parkinson's disease risk. quoting from this abstract, there is general consensus that pesticides are involved in the etiology of Parkinson's disease, although associations between specific pesticides and the risk of developing Parkinson's disease have not been well studied. So what's the way forward? As with anything across the board, whether it's TPLO or rushing in to cut backs of dogs that have paraparesis or paraplegia, let's start questioning. Let's start examining who says we should do this, that, or the other. Where is the evidence? And what is the other story that might not be being told? And what are the potential conflicts of interest? Why am I not learning this? Why do I have to go and search for another view outside of this institution? I mean, you should, anyways, look for other views, read the literature. And I would say don't necessarily buy what a company is trying to convince you of, whether it's a pharmaceutical company, whether it's a parasiticide company, whether it's a laser manufacturer, whatever it is, think independently. So who is paying your professors in research dollars, in whatever kind of funding, and sponsoring your educational meetings and your reading material? So think of that too. Is there a publication bias because that journal or that magazine or that trade publication, they're getting huge amounts of money from these companies? What does that tell you? What does that make you think about? Where is the information from non-sponsored agencies? So questions that may be helpful to ask. Why are flea products marketed so heavily? Why didn't I learn about these risks in vet school? Why am I not including toxicity from pesticides in my differentials? Whether you're treating an animal for diarrhea, for lethargy, depression, excessive thirst, seizures, coma, whatever it is, it's like, okay, maybe you're thinking of THC toxicosis first, but what about that flea product you just had the client apply? Why may I be risking my patients, clients, and my own health from the products I am recommending to clients? Another question, have I looked at the National Resources Defense Council, the NRDC, the different documents they have about poisons on pets, or the EPA even? What about non-synthetic insecticide control measures can I use for the animal? Even papers that are looking at all the different approaches, the whole spectrum from botanicals, essential oils, vaccines, everything. Why has the synthetic insecticide, topical, flea collar, or oral, why has that reached such prominence? Well, who's making all the money? Who is funding the research? Who is funding the people that are producing the research? Let's think about independent research or from agencies that don't have stock in pharmaceutical companies in one way or the other, whether real stock or promotional interests. And why am I not hearing more about these natural flea or tick control measures that are safe? Why have I never seen a comparison study of toxicity of all the common flea and tick control products? Why am I sending out emails touting, oh, spring is here, I'll give you 25% off flea and tick preparations now that the bugs are about, and not even include any mention of risks, giving that client perhaps a false impression that these are completely safe. It's like buying your pet food. Same place, just bundle it all up and I'll give it to my animal. I don't see a problem. There are problems and we should be talking about them. Why am I now selling products for puppies who's going to be on that agent, that chemical that kills things their whole life, and their nervous system isn't even fully developed? And why am I advising clients with indoor cats to purchase flea and tick products? So remember, the brain you save may even be your own. If you read the recent issue of the Journal of the Veterinary Medical Association and the letter to the editor, March 1st, 2021, just one letter to the editor, and I'll read you some excerpts from it. I am a 78-year-old veterinarian who 2 years ago began taking carbidopa-levodopa for treatment of Parkinson's disease. Parkinson's disease is the fastest growing neurologic disorder in the world, estimated to have affected 6.3 million people in 2015 and expected to affect up to 12.9 million people by 2040. He continues, about 10% of Parkinson's disease cases are thought to be related to genetics, and some cases are related to head trauma. However, data overwhelmingly suggests that exposure to pesticides such as paraquat or rotenone, to the nerve agent chlorpyrifos, and to solvents like trichloroethylene can also lead to Parkinson's disease. In my own case, contending with emotion issues associated with Parkinson's disease is aggravating, but the loss of verbal fluency resulting in slurred speech is even more of a challenge, making it hard for me to communicate and causing some clients to inquire about my weird accent. My experience leads me to wonder whether veterinarians have a higher incidence of Parkinson's disease than do members of the general population. Could repeated exposure to pesticides in flea and tick collars lead to Parkinson's disease? And with that, we'll wrap up for today. Thanks for joining us at another Cat Talk. If you'd like to learn science-based integrative medicine and rehabilitation, join us at Curacor Vet.